Hey guys, just calling you at GTA. We've got a 20-year-old male slip fall on ice. We'll give you some more information en route. It's going to be in about probably 10 minutes. 10-4, we got a semi-conscious, approximately 20 male slip and fall on ice outside his home. No alcohol, no drugs. As witnessed seizure activity after GCS of 13. That is a 5-4-3. And we have working on vital signs right now. Looks pale to color. He's not acting appropriately. He's very lethargic and confused and just really sleepy at this time, having to keep him awake. Decreased stats at 93% on room air, just getting some end tidal and ECG. So got an IV established, and we're going to see about 10 minutes.
Regina, I'm coming to you with a conscious alert, 37-year-old female. Patient's been complaining of some numbness and tingling to hands and feet. Previously in July, she had a cage to her back due to a disc compressing her spine. Patient was able to ambulate after that. However, she is experiencing extreme weakness, very unstable in her feet. Doctor advised that she experienced these symptoms to call. She's in a little bit of pain, giving her 975 of Tylenol. Vitally stable, and we'll be there in about 5.
We're on road with a 76-year-old female, GCS 15, had a fall approximately 2 hours ago. Has 2 head lacerations to the back, approximately an inch each, a little bit gaping. Bleeding was easily controlled quickly after it happened. Is concerned because she's on 2 blood thinners. Rated to pain 3 out of 10, just on the area of the lac. It's not lightheaded, no vision changes, no loss of consciousness. Blood pressure is 222 on 77. ECG is normal sinus rhythm at 60. Vitally stable otherwise, and see you in about 5 minutes.
Good evening, on route conscious alert 67 male, complaining of ongoing concerns, weakness since being in hospital or being hospitalized for uncontrolled AFib approximately a week ago, just discharged recently. We're seeing uncontrolled AFib on the monitor, uniform PVCs at times by Gemini PVCs. His pressure is 124 on 96. SATs are about 94.
They're currently en route with a 68-year-old female conscious alert. Today she had a fall at ground level. Trying to take off her sock, and it seems like she's dislocated her left shoulder. Some deformity to the anterior part of her shoulder. Otherwise, vitally stable, pulse is present, and we'll be there in about 7 minutes.
The Pasqua with 22 female functional alerts, including some abdominal pain and nausea. That's involving over the last few days. States that she was on a bender, went to detox, drank a half a Mickey this morning, which helped with the abdominal pain a bit, was still complaining some nausea. I've tried for an IV with no success. She's had 4 milligrams of Zofran intramuscular. Those are within normal limits, and we'll see you in about 3 minutes.
Hey, Pasqua, we're on route 2 with a 22-year-old male conscious and alert, complaining of feeling generally unwell just starting yesterday. Now has a cough, has felt more tired than normal, just low energy, lack of appetite. Feeling a bit congested. Kosachi is a little bit tacky, pulse is 114, but blood pressure is normal, 116 over 80. His stress are around 20 with room air stats 95%. Lungs are sounding clear and equal, currently afebrile at 36.3. He has no past medical history, and we'll see you in about 5.
Good morning. We're on route with a conscious alert, 55-year-old female, shortness of breath. Fever over the last couple of days. I've seen her doctor, diagnosed with bronchitis. I've been taking her probably more often than normal. Current vitals within normal limits, not on oxygen, and we'll be there in about 30 seconds.
Hey, Pasqua, we're on route 2 with a 93-year-old male conscious and alert. Just had a slip and fall on some ice today and landed on his right hip. Now complaining of pain to the right hip. There is some shortening and rotation present to that right hip, as well as 9 out of 10 pain. That increases on movement. CMS is present to the foot. Cap refills less than 2 seconds. Patient is vitally stable. No LOC at the time of the fall, and we'll see you in about 5.
We're on row with a 67-year-old female, GCS 15, had a fall on the stairs outside, complaining of 7 out of 10 pain to the left wrist, no obvious deformity, some numbness to the wrist and hand, pulse is present, that pain increases greatly with movement, is able to wiggle fingers a little bit, but cannot move the wrist at all. Also complaining of 7 out of 10 shoulder pain, is unable to lift that arm at all due to pain. Is stable, no obvious deformity, is using Ensenor currently for pain with some mild relief. We have the wrist splinted and a sling on the arm, and vitally stable. We'll see you in about 10 minutes.